All right, Brian, thank you very much. Meanwhile, parents, sometimes desperate to help their kids avoid being teased over their looks, are letting, in some cases, plastic surgery procedures for their children and teens. They're having them done. Apparently, that is now teenager plastic surgery, now up nearly 30%. Experts claim the spike is due to increased bullying. But would you be willing to put your child through this to stop the teasing? Dr. Anthony Youn is a plastic surgeon and the author of the memoir In Stitches, and Dr. Jennifer Walden is a plastic surgeon here in New York. And we're going to talk a little bit about this. Now, Dr. Youn, I understand this is not theoretical to you. You actually, as a teenager, had plastic surgery to do what?
Well, I think I come from a unique perspective in that, yeah, I'm a plastic surgeon, but my jaw when I was young was twice the size of Jay Leno's. I mean, it was crazy, and that's what I wrote about in my book, In Stitches, is how it felt like to grow up looking deformed, feeling different, and feeling like an outsider. So I think I can kind of come from both angles of this.
All right, and so you had it when you were 16 years old, and did the teasing stop immediately?
Well, my life didn't quite change the way I wanted it to. Eventually, I guess it did. But I think the big thing, is that there are these news reports about kids that are having surgery at the age of 7 for bullying. I mean, my surgery was at the age of 16, and most parents of teens may not agree with this, but a 16-year-old is much more mature than a 7-year-old.
Yeah. Dr. Walden, what do you think about plastic surgery to stop bullying?
Well, I think for a jaw surgery, like Tony's alluding to, the facial skeleton is more mature at the age of 16, but for certain procedures, a 6 or 7-year-old patient may entirely benefit from an otoplasty or an ear pinning because the ear has matured and grown by then, and it may cause a halt to the embarrassment and the teasing that they get, because children are very cruel in this image-related world we live in today.
Right.
With Facebook and MySpace and pictures going everywhere.
Sure. So, Jennifer, what kind of plastic surgery would you be for a child?
For a child in the early stages, otoplasty or ear pinning, as young as 14 or 15, rhinoplasty or nose job. For young men, even male breast reduction, because they're called that they have man boobs and things like that and get teased at the swimming pool. And for young women, female breast reduction.
Sure. Now, interestingly enough, Dr. Youn, even though you have had plastic surgery as a kid, you don't think it's a necessarily a good idea for kids and teenagers.
Yeah, there are a couple of issues here. I mean, I completely agree with Dr. Walden with what she's saying about kids that are 14, 15 and are having these issues. But a 7-year-old, in my opinion, having an otoplasty, they may be mature enough to have had that growth and to understand they look different, but are they mature enough to understand the ramifications of serious surgery?
Yeah.
As a parent, would you feel comfortable if your child had this elective cosmetic procedure, and what if they had a major complication? They don't really understand that.
That's right. They just want to get fixed. They don't realize it comes with a cost. A great debate.
Exactly.
Dr. Jennifer Walden and Dr. Tony Youn, we thank you both for joining us live.
Thanks.
Thank you.
All right.